I was diagnosed in May, late May, and I had surgery in second week of August. My first response was, well, I'm going to the Mayo Clinic, I'm going to Johns Hopkins, I'm going to wherever the best treatment can be provided is where I'm going. I went back to talk to my doctor about it, and he says, well, you know, if you want to spend all your money, because most insurance is not covered out of state for this treatment, he said, if you want to spend all your money, you go ahead, but we feel like that some of the best treatment available is right here in Birmingham. And you know, ironically, at the time, NBC had a week-long series about prostate cancer. And I religiously watched that every morning, and they had two individuals on there, one that had the radical surgery and then the other one that had the laparoscopic surgery. So it was very educational to me that week. I think the final decision really came about in realizing that the blood loss potential, along with the recovery time, I elected to go the laparoscopic prostatectomy. Went in early that morning. I was back in my room late morning. Was up and walking around late afternoon. Spent the night. I had to stay one extra day because of some blood complications, something totally different from the surgery itself. Stayed one extra day and was back home the following afternoon, out watering some of the plants in my garden. And you know, I look back and I've talked to a lot of people that have gone other routes, and I feel so fortunate because in 6 days' time, I drove myself back up to see the doctor and to attend that evening a cancer support group meeting. So people that I know that have had this surgery or had the radical surgery were months before they were able to do those kind of things. My concern was, how long do I have to live? And I think that some of these feelings, in retrospect, some of these feelings are very, very normal. I've talked to so many people that's gone through the same thing. And you don't know which way to turn. The first thing you want to do is gather all information you possibly can to find out what your options are. And you're doing this in a state of mind that, you know, generally I look at issues as being that the bottle maybe is half empty as opposed to half full. And it was pretty tough on me. I went through some very stressful emotions, denial, I'm going to die, what do I need to do? I need to get all my arrangements made. So yeah, you can go from one extreme to the other, but I think there is a period there, maybe, I guess it varies from individual, but I went through a period of about 30 days before I really got a grasp on this thing and what I was going to do about it. And then that trend starts developing of positive thinking, that I'm going to beat this. This is not going to happen to me. I'm going to do whatever I need to do to cure myself of this disease. And I elected to get the cancer removed from my body. I didn't want to leave any chances. I wanted to go in and get it out and get it over with. The actual experience of the incontinence, it varies obviously from individual to individual. I didn't have much of a problem with it. I wore the catheter for about 6 days, and after that I went through a procedure of wearing pads to protect the leakage that you're going to experience from time to time. But after probably about 2 weeks of the pads, I was back normal. I was out of work for 1 week. I was back behind my desk working. Obviously each individual is different as to their rehab time, but yeah, I've heard stories about guys being back to work within 10 days' time, picked right up where they left off again.